Hey everyone, it's Josh from Prescription Fitness, Physical Therapy, and Sports Care. I thought we're trying to make a video as frequently as humanly possible this month, as it is National Physical Therapy Month, all of October. So we've done a couple of videos so far, which have really just sort of discussed what does physical therapy mean to you. And I thought today we'd talk a little bit more specific, just kind of looking at specifically shoulder, most common shoulder pathology seen here in the clinic. So first thing we want to do is sort of understand, what does our shoulder really look like? So if we look at the shoulder, and we're looking at a stripped down model of the shoulder, so some of the bigger muscle groups, so our deltoid, our pectoral muscle, our lat muscles, all these are removed from the model. So we're really just looking at sort of the shoulder itself, and we can see the first thing is that it's not very stable. So the only attachment point to the entire skeleton is here where the clavicle attaches, right here to the sternum. Okay, that kind of wraps around, comes to the end, and you look in the back, and we have the scapula spine, and that with the clavicle and the scapula spine form the AC joint, which is right on top. It's that little bump on top of your shoulder. So our AC joint basically acts as a strut, so people born without clavicles can touch their shoulder blades or touch their shoulders in the front together, and that compresses all sorts of internal things, so not really a great thing. So we're looking at a rotator cuff. Otherwise, it is a cuff, not a cup. People like to say cup. So when we look at the rotator cuff, what we're looking at is we're looking at four distinct muscles. In the model here, the red represents muscle, the white represents tendon. Tendon is what attaches the muscle to the bone. So we have this big one in the front called the subscapularis. We have one on top here, okay, that slides through this little opening. That opening is about 1.5 centimeters, so it's not very big. This is called the supraspinatus. And then in the back, we have two other muscles. We have the infraspinatus, and then we have a smaller guy, the teres minor. So those four muscle groups that kind of sit on top of the ball, just kind of like this. So I'm going to put the model down so we can understand, what does the rotator cuff do? Well, it does a bunch of things, but sort of the key one to understand is really when we're looking at it. So here's the model. So here's our shoulder blade. Here's that subacromial shelf, and then this is where the ball sits in underneath the shelf. And so what happens is that as we go to move our arm up overhead, so the bigger muscles, our deltoid muscles, the primary mover. So as the deltoid starts to move the humeral head up, the rotator cuff's job is to drop the humeral head down so it spins out of the way. Now at a certain point it's going to hit. So now what happens is your shoulder blade is also going to rotate to maintain the distance between the top of the ball and the underside of what's called the subacromial space, so that we're not pinching these tendons up underneath the bone. We call it impingement. We're trying to get away from that because tactically the tissues impinge. Every time we raise our arm up overhead, the tissue will impinge, but it would be extra impingement. So that is the most common thing we see in the clinic, is that irritation on the bursal side or the top side of the rotator cuff as it pinches up underneath that shelf, because a number of reasons. Maybe there's a trauma or a muscle imbalance or something along those lines. So that is our quick shoulder anatomy lesson today, looking at our shoulder blade, looking at what is impingement syndrome. So many of us will be diagnosed with that, but then it's up to your physical therapist to find out what else is going on. So it can come from your thoracic spine position, it can come from the scapula, shoulder blade position, it can come from imbalances or weakness. So go to your physical therapist and they will figure it all out for you, because that's what we do. And again, it's Josh at Prescription Fitness, Physical Therapy, and Sports Care.